Today's video is on, do doctors care about heart rate variability and who can help boost your heart rate variability? You know, I'd love to read this quote to you because it really sets the stage for what I'm talking about. It's by Dr. Marcelo Campos, who's an MD. He said, have you ever wondered what the health impact of a stressful day was? Will you perform well during your long run tomorrow morning? Is there anything you can do today that would improve your ability to have a better day moving forward? Heart rate variability may be the best answer. Okay, so that's a doctor saying heart rate variability is an excellent measure. Let's talk about that as an overall biomarker for health. You know, we live in this era of accelerating change and social and political polarization and a culture that demands that we're always on or always available. And the result is we're under constant stress. Stress, when not managed properly, leads to disease. There's all kinds of science on this. And as the quote I just shared emphasizes, we need to understand and monitor the amount of stress our body is under and do something proactively about it, or the bill's going to come due in terms of short-term performance, mental health, our relationships, and more importantly, our long-term health. So I want to explore three things in this article. What is heart rate variability? How can I improve my heart rate variability? And who can help me increase it? Okay, that's really the most important piece here. So heart rate variability is the measure of the inner beat, meaning beat to beat variability between successive heart contractions. In layman's terms, it just means the change in time between successive heartbeats. Why measure it? Why measure HRV? Because our bodies are constantly adapting to changes in our environment, and variability is good. Okay, now heart rate, okay, your pulse is different than HRV. Heart rate is simply the rate at which your heart beats. It's easy to think that a consistent heartbeat rhythm would be good, but it's not. In fact, a consistent heartbeat is brittle, which means the ability of your heart to flex is lower, and therefore it's not going to perform as well as a flexible heart rate in the face of challenge or stress. And a simple analogy to help you better understand why HRV is so important and to address this brittle versus flexibility idea is to think of HRV as being like a rubber band, okay? Poor or low HRV is like a brittle, old, blackened rubber band that as soon as you pull on it, it snaps. Okay, and a person with high HRV is going to be like a new flexible rubber band. So when you pull on it, it stretches a long way. And so a person with low HRV is not going to handle the variability of life very well, and therefore is more susceptible to disease as well as mental health problems. A person who has great HRV or even improved HRV is going to see improvements in performance, focus, immune function, resilience, sleep, and the ability to perform at a high level because their heart is flexible and it's highly resilient in the face of challenge, okay? So that's the big idea, all right? Now, how can you improve it? All right, now there's a lot of science here. We're just going to give you a little bit of an overview, but the bottom line is having data and then making small tweaks in your lifestyle and your habits over time. And when you do that, you should see generally a positive upward trend at HRV, okay? Now, the thing that you need to know is how you feel. It matters, but it's not a reliable factor. We need data, okay? So you're gonna wanna have a wearable device like an Oura Ring, a Whoop band, a Garmin, a Fitbit, any number of devices. We also like to use HeartMath as a trainer for HRV with diaphragmatic breathing. So there's the top 4 ways to improve your HRV, in my opinion, is diaphragmatic breathing. Number 2, optimizing your sleep. Number 3, daily movement. And number 4, a mindfulness practice. And if you can obtain a device where you can see data and get biofeedback on how you're doing and implement these 4 lifestyle habits, over time, you should see your HRV improve, okay, in what's called the MS score. The older you are, the lower your starting point is going to be because you've had a lot of accumulated stress in your life, okay? The score isn't vital. What's important after you start is seeing the trend line go up, okay? That's what you want to monitor. Now, understanding HRV and learning how to improve your score, in my opinion, are best done under the direction and care of a highly qualified health coach, trainer, and/or physician, okay? So let's talk about who can help you increase HRV. Well, I just said a personal trainer who understands it, a health coach who understands it, and I find that very few integrate HRV training with their training. That's what makes Tiger Medical Institute unique. In addition to our medical interventions, we integrate sleep optimization, HRV training, and 6 other habits that all synergize and improve your HRV, okay? At Tiger Medical, you're going to operate and function under the direction of a credentialed physician as well as a health coach, all right? And in addition to that, we're going to bring a high degree of clinical testing to the picture, depending on the level that you participate with us in. And we're going to be able to integrate your physiological lab test results and potentially your genetics with your HRV and wearable device data. Now you're talking a serious optimization of your overall physiology, okay? So I would encourage you, if you really want to take it to the next level, if you want to optimize your heart rate variability and gain the benefits and what the data says regarding health span, longevity, immune function, focus, resilience, I would strongly encourage you to consider meeting with a professional at Tiger and learning how we do this. All right. And so your next best step here is go on our website, click on health assessment, and then you get to talk to me or someone like me on the team. And we can make sure you're a good fit, understand your history and what your goals are first. And then if you are, then we'll present options. If not, we will tell you and try to help you find another place. If you're not quite ready for that, go into our learning center and look under the stress tab and the sleep tab and just read some of the articles there. I think will be helpful. So thank you. I hope this was helpful. Have a great day.